everyone, hope you're well. So today I'm going to be talking about PPE and the clinic procedures that we have in place that will be there to sort of help protect us post the ending of lockdown. Right, so first of all, I'm going to be minimizing the clinic time to minimize the risk of you coming into contact with any pathogens. So one of the things we're going to be doing is we are going to be doing online consults prior to the treatment. I'll be going through the consent forms and we will be doing payment all online prior to you coming into the clinic, because we need to minimize the amount of time that you are in clinic for. I'm also going to be asking you to come to your appointments on time, because there's going to be a lot of cleaning procedures that need to be done. So I'm going to stretch out those appointments and I'm going to ask you to come to your appointment on time. If you are early, I'm going to ask you to either message me to find out if I am ready for you, because there's certain sort of cleaning procedures that need to be done, and ventilation. So they're recommending a good 15 minutes of ventilation between patients. So I need to make sure that that's done and completed before you come to your appointment. Now, the new clinic in Beckenham, I'm very excited to get that up and running. I have seen it, and one of the great advantages there is, of course, that it's private and it has a one-way system. So what that means is that you'll be able to come to the clinic, you will come in the main entrance, you will come through for your treatment, and then you will be able to leave through a second entrance, so no one will be able to see you leave the clinic. And of course you then won't you won't cross over with any other patients, and we won't have that risk of contamination. So that's an added bonus of the clinic. I won't be having the waiting room open for the first month, so I would ask you not to sort of congregate in the waiting room, and rather to kind of stick to the appointment times. The waiting room won't have any sort of pamphlets or books or reading materials, because we want to minimize any sort of touch points and any risk of spreading the virus, because you know that the virus can last on paper. So I would like to make sure that there isn't any risk of that for you. Between treatments, I'm also going to be cleaning all the door handles, any of the touch points that you might encounter when you come to the clinic. So I want to make sure that we minimize that. Now, let's have a look at what the procedure will look like. So we would have gone through everything online, we would have decided on your treatment, you would have booked the treatment time, we'd have done the payment, we'd have done the consent. So you will literally be coming for your appointment, and these are going to be very short appointment times. They're going to be further spaced, but it's going to allow me to do that vital cleaning. On arrival at the clinic, you will come up the stairs and you will be asked to wash your hands. Now, I'm going to be providing bacterial hand wash, and I'm going to ask you to follow the correct procedure for washing your hands. Now, we're looking at between 40 and 60 seconds of washing, and the reason you've been seeing all these videos and you've been seeing a lot of demonstration on how to do hand washing, and I will have a video for you to watch, is because some people do wash their hands very badly and then they miss areas of contamination. I know during my medical career, we've done a lot of tests where they would put like a dye on our hands, ultraviolet dye. They'd ask us to wash our hands, and then they would check to see if we'd actually done the procedure properly. And you can see areas that you miss. So the correct procedure would be place the soap onto your cupped hand. You would then create a lather. You would want to get both sides of your hands between the fingers. You want to make sure that you get the tops of the fingers. So you want to make sure that you're rubbing those in. You want to make sure that you get the hands. So you either want to be doing this, or you want to be reaching through each finger. So make sure that you're wiping each finger, and you want to make sure that you get the wrists. Right, so that is, and then you want to rinse. So that will take you between 40 to 60 seconds. Okay, I will then ask you to place your shoe covers, which you will be given onto your shoes. So these will be plastic kind of booties that you're going to be putting on. The reason I'm asking you to do that is because that there is a lot of contamination on the streets. People are spitting, and that unfortunately contains the virus, or can contain the virus. And I need you to make sure that the clinic is as clean as possible. So I'm going to be asking you to put on these shoe covers before you enter the clinic. Now, the question I've been asked is, Do you need to wear a mask when you come? The reason that we wear masks is, the ones that we can make at home, or different types of face coverings and not the actual medical ones, is because they prevent respiratory droplet spread, and they can protect other people from your respiratory droplets, so prevent the spread of the virus. Now, if you do come to the clinic and you have your own, you're welcome to wear it if we're doing a treatment that doesn't involve the lower face. If you're going to be having lower face treatment, then of course you won't be able to wear that because I need to be working in that area. If you're having a treatment on the neck or the décolletage or the body, then of course you will be welcome to wear that mask. So for your mask, your surgical mask, to put that on, you will grab the mask. I want you to minimize the touching of the mask. You would have washed your hands. You will place the mask on, clip it behind your ears, make sure it fits at the bottom, and give it a little tweak on the nose. And that is all you need to do to touch, no more touching of that mask. You will wear this mask for the entire procedure, and then when you are done, you will take it off without touching the mask again. So use the edges, pull it off, and then there will be a bin for you to discard. It'll be a pedal bin so that you can use your foot to open, so minimize the touching. All right. Do you need to wear gloves to come to the clinic? No, you don't need to wear gloves to come to the clinic. Gloves is a bit of a mindset, and if you've been in the medical profession for a long period of time, then you have the mindset of wearing gloves. But what I am seeing is a lot of people will put gloves on and use that as an excuse because they feel that they are safe, and then they touch multiple things and don't think about what they're touching. Now, when you have gloves on, your mindset needs to be that you can't touch anything else, and you need to be very careful. And that's something that is sort of over the years you learn if you do use gloves all the time. Now, the correct way to put gloves on is to grab them by the edge, pull on the glove so that the glove then comes on to the fingers, and you don't want to be touching the rest of the glove. Again, you sort of grab the edge, slide your hand into the glove, and pull down to the bottom. And that's how you put the glove on. When you are taking the gloves off, if you are going to be wearing gloves, then you need to grab the edge of the glove, pull the glove up and over, grab the glove, and that is how you dispose of them in the bin, and then you wash your hands fully. If you don't have access to hand wash after you've taken them off, you may use hand sanitizer, and you need to use these for about 20 seconds. It's also not just a spray on and do that. It's literally put on, rub both sides of your hands, rub the fingertips in, make sure that you get both palms, and do the edges, and that should take you about 20 seconds. But it's almost the same procedure like washing, but with the hand sanitizer. So I've seen people just do that and be done. It does need to be a little bit more of a process. Right, so like I said, you are welcome to wear external gloves, like the gloves that you wear when you're gardening, to put those on, but I wouldn't encourage you to wear medical gloves unless you have a medical mindset and you are doing a medical procedure, because that is when they need it. But you're welcome to wear protective sort of gloves, but to bear in mind that if you're touching multiple areas, then that also isn't a good idea. So no. To answer the question of should you wear gloves to the clinic, no, you don't have to wear gloves to the clinic, and you don't have to wear them during a procedure. So when you do come and have your treatment, as standard, we will be using these sterile packs for each patient. I will also be cleansing with Clinicept, which is the new gold standard of cleaning, which we've been using in the clinic for the last year and a half. So we're going to be using those. We will of course be using gloves for every procedure as always, and they're included in the sterile pack. Right, then the next question is, patients have asked me about can they come with their hair uncovered? Absolutely. When you come to the clinic, I will be offering you the usual hair net, and that is to prevent the hair from falling into the treatment area. And I will be wearing, I've kind of upgraded myself, I'm going to be going to the scrub cap. So I'm going to be wearing a form of scrub cap, which will make sure that I am as clean as possible and the hair is out of the way. So it's going to look a little bit more medical than it has in the past. You're also going to be seeing my scrub top. I'm going to be wearing my scrubs, and my beloved Crocs. Not a fan, not everyone's a fan. I'm going to be wearing those as well as part of the uniform. I know in the past we might have worn smart outfit when you come to see me, but I think we do need to be a little bit careful, and unfortunately you can get virus particles sitting on the clothing that we wear. So I'm going to be wearing my medical scrubs. I'm also going to be wearing protective layer. So you will see me wearing either an apron, so a plastic apron, or I'm going to be wearing a full gown that will be full length and will cover up to my neck, and that's if we're going to be doing very long procedures, or we're going to be doing procedures that I consider at a risk of producing aerosol particles. So lip fillers will be one of the treatments that I'm going to be wearing the gown for. I don't have one open because they're quite expensive, so I'm just going to I'll just tell you about those but not actually put those on. Then I'm going to be wearing the N95 or FFP2 or 3 mask, so I'm going to pop that on. And an adjustment. Right, so that is me with the mask on, and then I'm going to put the shield on. So that is going to be the protection that I'm going to be wearing. And these will be cleaned between patients. And these, of course, will be single use. Between each patient, we're going to be cleaning the clinic very thoroughly. I will be using Clinell wipes, or I will be using the Clinicept. And we will need to decontaminate all the touch points in the clinic. So anywhere that a patient may have touched, we'll be cleaning down the couches, and we will be cleaning the treatment surfaces. So we will need time to do that between patients. So that's why the appointment times are going to be a little bit longer and a bit further apart. After seeing each patient, I will of course wash my hands again and discard of the PPE. I hope that's been helpful. If you do have any questions about the procedures in clinic, please let me know. The patients will of course receive all this information before they do come for an appointment. In the meantime though, if you do have any questions or queries, please let me know in the comments. Otherwise, email me and I will respond directly. All right then, have a good evening. Bye-bye.